I'd like to introduce our final session, which is the BJS Lecture. I am very pleased to be able to invite Fabien Lareyre, who is consultant vascular surgeon and head of the Department of Vascular and Endovascular Surgery in Antibes, to come and inform us of the emerging role of AI in vascular surgery. Fabien.
Thank you. Thanks for the kind invitation. It's a real pleasure for me to present today about the emerging role of artificial intelligence in vascular surgery. So I'm a consultant in the south of France at the hospital of Antibes. I find the title very interesting because we are talking about artificial intelligence as an emerging technology. But AI is not new. Early concepts are found in myths and legends from the antique world. In the Greek mythology, the myth of Talos described a giant made of bronze who protected the island of Crete. He was supposed to be invulnerable, but he was finally defeated and killed due to a wound close to his ankle. There is also the myth of Pygmalion. Pygmalion was a Cyprus sculptor who made an ivory sculpture of a woman that he found so perfect that he fell in love with it. He married to the woman, and thanks to Aphrodite's blessing, the goddess of love, the sculpture became a real woman. And finally, there is Hephaestus, the Greek god of artisans, blacksmiths, and metal workers. He built and used automaton of metal to work for him. So the concept to use machine to perform human work and task is not new. And the fantasy to bring life to machine and objects is a concept older than 2,000 years. The 20th century witnessed the shift from myth to reality with the first computers. In 1940, Alan Turing developed the concept of a modern computer. He called it a universal machine. And he proved that the machine was capable of computing anything if programmed with executing instructions stored on tape. But the real term artificial intelligence was firstly described in America at the Dartmouth College by John McCarthy. And then AI research programs explode and show encouraging results, with a great optimism. However, this optimism was followed by what we call an AI winter. And AI researcher faces many technical limitations, with a drastic decrease of fundings. But in 1980, we had an AI renewal with new direction. But then again, it was followed by a decrease of fundings. The 21st century is the new era of artificial intelligence. With the increase of computational power, with the development of machine learning, with the access to the big data, it led us to develop a successful advanced technique in a wide range of fields. So what is artificial intelligence? Artificial intelligence is a discipline that aims to understand and design systems that display properties of human intelligence. It's an interdisciplinary approach, and AI can be considered as the ability of a machine or a device to make autonomous decisions based on data collected. So, what are the fundamentals in artificial intelligence that vascular surgeons should know? Artificial intelligence is a very broad domain that regroups three main fields. Natural language processing, which is application for speech or written language, robotic and innovative devices, and the field of the vision, which is application for images or videos. Machine learning is a subdiscipline of artificial intelligence where you give the machine the ability to learn from dataset. And deep learning is a subtype of machine learning where you give the machine a large quantity of raw data That's what we call big data. The main AI algorithm used are the artificial neural network or the CNN, the convolutional neural network. Artificial intelligence brought new perspective in both medical research and clinical practice. We recently performed a bibliometric analysis on the application of artificial intelligence in vascular surgery, focuses on three main diseases: aortic aneurysm, carotid stenosis, and peripheral artery disease. And we show that we had an increase of articles published, especially between 2015 and 2020. The three main countries on the podium, USA, China, and UK, followed by the other European countries. So AI is not new, but its application in vascular surgery has emerged only recently. There is a wide range of application of artificial intelligence in vascular surgery. Let me give you a brief overview. In NLP, it can be useful for an automatic identification of patients with vascular diseases in medical records. This can improve the screening and facilitate a large-scale analysis, especially in vascular registries. In the field of the vision, it can be helpful for an automatic detection, characterization, and classification of vascular diseases. This is good to improve the screening again, for the diagnosis, and of course the pre-surgical planning and the follow-up. In the field of the machine learning, it can be useful to have some prediction model. So let's have a look on how we can use machine learning to predict outcomes. So machine learning algorithm can be useful to predict the progress of the disease and other associated complications. For example, in aneurysm to predict the aneurysm growth or rupture. In PAD to predict the risk of amputation or wound healing. Or in carotid stenosis to predict the stroke risk. You can also develop machine learning algorithms to predict survival and risk of rehospitalization. And importantly, you can use ML algorithm to predict complications related to treatment. Embolics after EVAR, bleeding risk after PAD procedure, or ischemic stroke after carotid endarterectomy. Now I'll give you some examples. The Department of Surgery, University of Toronto, developed several machine learning models to predict outcomes, and they use the VQA database, thousands of patients. Interestingly, the machine learning algorithm they use perform better than the classical statistical analysis, such as the logistic regression, showing the interest of machine learning in this setting. Now, the field of the vision. AI can be useful for an advanced imaging analysis. Our team was among pioneers to develop an automatic segmentation of the vascular system using AI algorithm and deep learning. It brought new perspective for clinical research and clinical practice. In clinical practice, to detect and diagnose the disease, to facilitate anatomical characterization, and of course, to improve the reproducibility of the measurement and to decrease the computational time. It's also helpful to facilitate the preoperative planning and to better detect postoperative complications. But AI can also be useful for clinical research to provide a fast and detailed analysis of all the characteristics of the vascular system, even to identify imaging patterns, and again to develop predictive model, all of this for a personalized therapeutic approach. Here are some examples of authors, mainly from France, developed AI algorithm, convolutional neural network, for an automatic measurement of the maximal AAA diameter. And the author finds a very good correlation with manual segmentation performed by human experts, vascular surgeon and radiologist. Now, the third field, the natural language processing. NLP can be useful for identification and extraction of medical information. And as I was saying, it can facilitate analysis in a large data sets to evaluate current practice. It can also be helpful to optimize prevention and public health surveillance program and generate alerts from medical records. This can optimize orientation, triage of patients, and reference to vascular specialists when needed. Let's have a word about the chatbot, because you heard about ChatGPT 2 years ago now, but how AI chatbot can be useful for us vascular surgeons. It can do various tasks, and it can be useful for clinicians, of course, but also for patients. In vascular surgery, but in all other specialties. For patients, it's a source of information, education. It can be an assistance for planning and follow-up. And also, we have to keep in mind now that NLP algorithm embedded all the application in telemedicine. For clinicians, it can be useful for writing assistance and administrative work and the support at decision-making. So we spoke about AI in clinical setting, but what about artificial intelligence in vascular research? It can be useful for data mining and drug discovery, for data analysis, and also for us vascular surgeons, it can be helpful for a literature search and a scientific writing. We recently performed with the European Vascular Research Collaborative a survey on the use and perception of AI in vascular surgery. More than 200 participants from 23 countries. And many concerns on the use of AI for scientific writing was raised. Concern about plagiarism, concern about the quality or accuracy of the scientific content generated, and concerns about lack of transparency. This led us to think about education on artificial intelligence in vascular surgery. Artificial intelligence brought new innovative pedagogic tools. We saw that just before. Adaptive learning, simulation, augmented reality, but it brought also many challenges. And in our survey, more than 80 vascular surgeons declared not having any training or education related to AI in healthcare. So it underlies the real need of training for vascular surgeons if we want to use it in our daily clinical practice. So the emerging role of AI, what is at the bottom of the iceberg? The accuracy of the machine learning model depends on the availability, the quality, and the volume of the data. And we have also to keep in mind that AI algorithms function like a black box concept. So before its implementation in clinical practice, we have to think about medico-economic studies to assess the clinical benefits and the economic impact. Also, note that the majority of the models developed and tested are based on retrospective data. So external validation is of utmost importance if we want a generalizability in population with other demographic, ethnic, or socioeconomic characteristics. And just a brief word about old and the huge ethical and legal framework. We have to work with the respect of data protection, security, and patient privacy. And we also have to think about the data ownership and the governance. So now it's really the time to build international consortium, to work with vascular registry. And that's what we are doing with VascuNet, the committee from the ESVS, working with the SVS VQI through the ICVR. We have to develop large-scale prospective studies, RCT. That's what we try to do with the European Research from the ESVS. And we have to develop international data lake on artificial intelligence. Recently, from the University of Oxford, build a strong consortium, the Net Zero, and he talked about it, I think, yesterday. So it's really time for a multidisciplinary cross-border collaboration. We have to work with all the vascular research group in Europe and abroad. So, AI in vascular surgery, what is next? We've come from a long way with the development of vascular sutures, the open surgery, and then the endovascular surgery. Then we achieve complex endovascular procedure. But what is next? I think it's the digital era. Artificial intelligence has to be considered in an ecosystem intricated in the digital era. And we can also use the term e-health or digital health. It regroups the telemedicine with all the teleconsultation, telemonitoring, telesurveillance, whatever. The health application, mHealth, mobile phone technology. It regroups also smart devices and connected systems, sensors, trackers, and wearable technology. So artificial intelligence can be used and provide technical support in every field of e-health or digital health. Now, the question you're thinking about is, will AI replace vascular surgeon? The fear to be replaced by a machine is not new again. In the movie The Modern Time, Charlie Chaplin was already asking questions about the place of machine in human life. We also have to think that machine won against our best world champion in chess, Garry Kasparov, or in Go with Lee Sedol. So what's the difference between the machines and the man? Machines do not think and do not have feelings. Machines are not aware of finitude of life. And of course, machines cannot reproduce themselves. But they can mimic human behavior and can perform better than us, only for selected tasks they have been trained for. So instead of opposing man versus machine, we should think about man empowered by machine. We need to have supervision and final human expertise. As vascular surgeon, we have the responsibility. As a doctor, we have a unique relationship with patients based on trust, empathy, support, and communication. So beyond the impact of artificial intelligence on patients, we have to think about the impact on healthcare system, the impact on the society, and of course, the impact on the environment. So artificial intelligence needs to be integrated into the concept of One Health. Thank you for your attention.
Thank you, Fabien, for giving stay up on the podium, for giving the BJS Academy lecture. As many of you will know, Jonathan Earnshaw, vascular surgeon, retired, a past secretary of this society, and the first director of the aneurysm screening program, is the director of the BJS Academy. Vascular Society are delighted to work with the BJS, and this talk and other talks from the main sessions will be available on the BJS Academy website, along with accompanying commentaries. So do please look at those. Fabien, come back up. I've been looking at your Twitter profile. Not only do you remind me what it's like living on the Côte d'Azur with sunny walks and cups of coffee, but you are recognised for your directional divisional leadership, your work with the European Society, and I'm really pleased to see, at the end, husband and dad. Perhaps you'd like to add to that, friend of the Vascular Society. We certainly consider you a good friend, and thank you for delivering the 2024 BJS Lecture.
Thank you.